Hello everyone, I'm Millie Swan, a Vice President here at Forest Health, and joining me today I have Dr. Brian Batson, who's CEO with the Hattiesburg Clinic, and Dr. Steve Farrell, who is the Chief Medical Officer at Forest General. Thank you for joining us today. As we've all seen, the rise in COVID over the past few weeks, a lot of anxious people out there, a lot of fear, and rightly so. Most of us now have seen people that we know pass away from COVID, may be hospitalized with COVID, may be dealing with COVID at home. So a lot of anxiety out there. And so today we'd just really like to give an update. We're all guilty of reading things on the internet, watching a TikTok video, listening to someone who may not have that science-based knowledge to be giving advice. So today we really want to try to inform and educate and go over some basic questions that we're hearing from probably all of our family and friends. So Dr. Batson, I'll start with you. The biggest question usually is the vaccine safe?
Millie, it is a question we continue to get. This vaccine, as you may recall, physicians began getting the vaccine in December, but prior to that, clinical trials were done studying this vaccine. Up to this point, almost 350 million doses of this vaccine have been administered just in the United States. So safety trials were done during the clinical trials, and safety monitoring has been ongoing throughout all these millions of doses, and it continues to show that these are safe vaccines.
And another big question following with that is, which one is best? Pfizer, Moderna, etc.?
Sure. Really the best answer to that is whichever vaccine someone can get, that's the best one. The benefit of the Johnson & Johnson vaccine is that it is a single dose. The Pfizer and Moderna vaccines are 2 doses, but all 3 vaccines are effective in preventing the spread of COVID.
Okay. Dr. Farrell, we hear a lot of people say, oh, I'm fine, I've had the vaccine. Does the vaccine prevent you from getting COVID?
In absolute terms, the vaccine was designed to prevent the severity of illness. It was designed to prevent the spread of COVID. And so another way to ask that question is, can I still get COVID if I've been vaccinated? And the answer to that question is absolutely yes, you can. What's very important to know about that is that someone who has not been vaccinated and gets COVID has a very strong chance of getting ill enough to go in the hospital, the ICU, or even to die from it. What we do know in all the science and literature is that if you are fully vaccinated, it significantly reduces your chance of getting sick enough to go in the hospital. It reduces your chance of going in the intensive care unit and being placed on a ventilator, and it reduces your chance of dying from COVID.
Okay, yes, that's always the big question. Will I end up in the ICU? Will I be on a vent? Will this prevent that? So right now we're seeing that it does help prevent that. Dr. Batson, is it true that the Delta variant spreads a lot quicker and faster and at a higher rate?
Yes, the Delta variant, we began seeing this in our area 3, 4, 5 weeks ago. We started to see large clusters of families who were coming in with COVID, and we noticed that it was really spreading real quickly in the households. And that has proven to be true as we've learned more and more about the Delta variant, that it is significantly more transmissible, more contagious, if you will. So for every one patient who gets COVID with the Delta variant, it's estimated that another 8 to 9 people may be infected by that one person.
Are we already seeing other variants in the U.S.? That's been a big question.
Yes, there have been some reports of the Lambda variant in Texas. We are still learning more about these additional variants. There are other variants that have been reported across the world as well.
Okay, and do we know yet, is the vaccine going to be able to, help us to fight these new variants?
At this point, it does appear that the vaccines continue to be effective against these new variants, but still they're rather new, and we're continuing to learn more about them.
Okay. Dr. Farrell, do people need a booster that have been vaccinated? That's a big question right now.
And that's a great question. I asked that myself, having been one of the first people who got the vaccine. Certainly Pfizer has applied to be able to give the 3rd dose or the booster dose. It has not been approved yet. It is being recommended for those patients who are in an immunocompromised state or condition. All right, those patients who may be on chemotherapy, those patients who may take medications for different medical conditions which reduce their immune response, or those patients who may be at higher risk, end-stage renal disease patients on dialysis. Those are the ones we currently believe benefit the most from receiving a booster vaccine. I think in the next few months we will see whether or not it is approved for everyone. There is some thought, as you saw in the news a while back, that the Pfizer efficacy at 6 months went down a little bit, but it still was quite substantial in its protection.
Okay. Dr. Batson, one question I think that people are asking, if you've been exposed to the Delta variant, I know at one time we were hearing, like 3 to 5 days. Now, is this one showing up a little sooner?
There does appear to be a slightly earlier, for the person who catches it from someone else, maybe a day or so earlier in that 2 to 4 day range. Someone may test positive if they've been exposed to the Delta variant. They're still very similar, so that somewhere in that 2 to 6 day range is usually when the exposed patient will turn positive if they were exposed enough to contract the virus.
Okay. Dr. Farrell, one thing that we hear a lot is, well, I think I've got COVID, I'm not sure, but I've got all the symptoms. I think I'm just gonna, ride it out. I don't really need to go be tested. Why is it important for people to go be tested?
I think there's 2 real good reasons right now. One reason is that if you are positive and you fit into certain categories of patients who carry a little more weight, they're a little overweight, patients who are older, patients who have certain medical conditions, would benefit from the administration of monoclonal antibodies, which will significantly reduce how ill they might become if they are known to be positive. So that's one reason to get tested if you believe you might be infected. But the real reason to be tested is so that you can ensure that you're not spreading the virus to other people. So if you feel like you might be infected, the chances of you quarantining yourself effectively without knowing you're positive are kind of slim. However, if you know you're positive and other people in your family know you're positive, the effect to quarantine yourself and reduce the spread amongst your close contacts is greatly enhanced. So getting tested if you feel like you might be infected is very important.
Okay, and you mentioned the monoclonal antibodies. Dr. Batson, can you explain a little bit about what that is and who would definitely be eligible for that?
Sure. Monoclonal antibody therapy has been available for a few months. There are multiple options available, and it's being administered throughout the state. In fact, the Mississippi Department of Health website lists the locations that provide monoclonal antibody therapy. Generally speaking, this is given as an infusion over 20 to 60 minutes, and then patients are observed for about an hour after this medication. These medications are also approved under emergency use authorization at this point. I will point out that the infusion therapy is what we've been using most regularly. However, recent information approved as well for emergency use the subcutaneous use of monoclonal antibodies, so injections or shots for this therapy.
Okay. Dr. Farrell, a lot of people are asking the question, what if someone in my household comes down with COVID and I'm exposed? What do we do in our household?
Probably the hardest thing to do is to quarantine yourself in your household away from someone who's known to be positive. But the best thing you can do is to use all those things that are listed on the CDC website. And that includes really effective cleanliness and hand washing, segregating the infected person away from the other people in the household to the very best of your ability, including wearing masks if you're able to do that, because that certainly diminishes the amount that you can, chance you can get an infection from them. But household contacts of positive patients also have to quarantine themselves, okay? Right now, the recommendation is that you quarantine for 14 days, or you quarantine for 10 days and then follow the symptoms, or quarantine for 7 days and get a test, and if the test is negative, then you continue to wear a mask as you go out and continue to watch for symptoms. But the biggest thing there is to quarantine yourself from the public in general, as well as to try to segregate yourself from the household contact who is COVID positive.